Okay, good morning, everybody. I'm going to suggest we make a start. Good morning and welcome. I'm Andrew Ridley. I'm chairing this morning's evidence-taking session. Thank you very much for finding the time. I have to start with housekeeping, which is, because this has been televised and tweeted, I'm asked to ask you if you could switch off mobile phones to prevent interference if you can. Whilst you do that, I'm going to ask my fellow members of the Health Commission to introduce themselves, and then we'll ask panel members to introduce themselves. Ron.
Okay. Ron Kerr, I'm Chief Executive of Guy's and St Thomas's Foundation Trust in South London, which has obviously got both Guy's and St Thomas's hospitals, but also the community services provision for Lambeth and Southwark boroughs. I used to be Regional Director of North Thames Region, so I know this patch well and lived locally for a very long time.
Thank you. Jeremy.
And I'm Jeremy Taylor. I'm Chief Executive of National Voices, which is the National Coalition of Health and Care Charities in England, and our job is to champion a stronger role and voice for patients, service users and people in decisions about health and care.
Great, thank you very much. Let's hear from our guests, and if you could introduce yourself, and then we'll open up for discussion on this morning's main theme.
Hi, I'm Mary Morris. I'm Head of Health Improvement at Haringey Council Public Health. I've got a background in drugs and alcohol and working with the homeless people for over 20 years.
I'm Maria Abraham, Health and Wellbeing Manager at Tottenham Hotspur Foundation. We deliver various community schemes in Waltham Forest, Haringey, Enfield and Barnet, and health is my responsibility.
I'm Philip Carey, Programmes Director at London Youth. We're a network of 400 community youth organisations around the capital.
I'm Michael Adams. I am a Youth Advisory Board member and a trustee at London Youth.
I'm Abdul Mahmood. I'm a Communications Support Officer at London Youth.
John Jones, Sport Development Officer at London Youth.
I'm David Russell. I'm the Head of Health and Social Care at SPICE. We deliver time banking programmes across England and Wales.
I'm Laura Woodley. I'm Projects Officer at North London Cares. We work with young people and older people in the community in Camden and Islington, matching up them with social clubs and befriending help around the houses.
I'm Alex Smith. I work with Laura as well on North London Cares.
Good morning, I'm Eleanor Bottrot. I'm the CEO with the Castlehaven Community Association. I'd like to welcome you to our site. We work with children under 5. I think our youngest member is about 3 months old and our oldest member is about 94, focusing a lot on social engagement and fitness in its broadest terms. We also have a 4-acre open space, so the environment and environmental projects focusing around community gardening is a new initiative in as much as involving the community and the gardens rather than just looking after them.
Thank you. And I'm John Dales. I'm a traffic engineer, but it's not all my fault. And I run a small urban design company. We spend most of our time redesigning urban streets, just like the High Street and places like that.
Great, thank you very much, and welcome to our audience members as well. Feel free to join in or ask questions. We'd like to keep this session as informal as possible, so please, people who come to tell us things, don't hold back. We're particularly focusing these sessions now on solutions, really, that would feature in the final recommendations of the Commission when it reports in the autumn, on things that perhaps it's worth asking yourself, if you had the ability to be in charge of health and social care for London, what recommendations would you make, and what action would you like to see to help us both make the most of the assets of the city, but also tackle some of the long-standing health challenges? Eleanor, as the host, I wonder if we might start with you, and are there any particular recommendations that you would like to see the Commission take on in terms of the role of community organisations such as yourself, and what role they can play in helping us tackle long-standing health issues?
I suppose the sector that I work in probably has the best engagement or the widest engagement with the broadest community, often those that are most difficult to contact or build relationships with anyway. So recognising the skills and expertise that lay within those agencies would be a really good place to start. It does feel as if we argue a lot with public health around the issues as they relate to the community in its broadest terms. There's a sense that because we're not necessarily health experts, that we don't always know what we're talking about. And actually, I think there are times when we have a much better, much more open and transparent relationship with the harder to engage members of the community than is always recognised by health professionals.
And can you give some concrete examples of that?
We do a huge amount of work with older people, particularly those suffering with isolation and loneliness, which demonstrates itself now as being, and is accepted now as being a huge element in the physical and emotional well-being of older people. Our project, with nearly 300 members, has never had public funding. It's always been funded through charities and the lottery, which we've just recently secured a further 5 years funding from it. But simply because we don't collect our evidence clinically, it's often anecdotal, but very clear. One of my favourite stories was an elderly lady that came here who'd nursed her very frail and sick husband over the last 5 or 6 years of his life. He'd died, but in the 6 years, she'd lost contact with her extended family and all her friends. She turned up here with nothing to do and nowhere to go, and it takes a lot of courage to walk in anywhere. Her needs were just to have somebody to speak to. I met her again after I introduced her to our Older People's Project and left her in the capable hands of our staff team, and coincidentally met her again about 3 months later and said to her, "How are you doing?" She went, "Look," it's rummaged in her bag and went, look what I've had to buy. And she got out this dear little calendar and a diary and said, "I've had to buy a diary because I've got so much to do now." Her body language had changed, she was upright, there were smiles on her face, she felt engaged in her society and community again. And other than that, somebody would have quite possibly been nursing her through an illness, but she was capable of doing it herself from that on. She's still around, thankfully, and still engaged with us on a regular basis.
May I ask a question? So you said that you don't get any funding from the public sector, which I think is quite admirable. On the other hand, do you think it would be a good thing if, for example, Camden CCG or other parts of the NHS actually did commission you to do work that was about improving health and well-being, recognising that you had an important thing to bring to the mix?
I think the recognition is probably more important than the funding. I recognise that public money is limited, but there was a real risk just 6 months ago that the project would literally fail, not because of any lack of care or any lack of need, simply because of finances. So even supporting us getting funding from elsewhere would have been, welcome. The reality is that it is funded again, but come another 5 years' time, we're back in the same square that we've consistently seemed to return to. I recognise that the funding within Camden, for sure, is for services for those with critical and substantial needs, which I think is laudable. But there's a significant number, particularly of older people, that are going to end up in that position if there's not some preventative work happening for and with them. And I think with them is as important as for them, because older people just, for the most part, need to know they've still got something of significance and value to offer to the community in order to feel happier and well in themselves.
Can I just ask about, you mentioned there was some debate, I suppose, I'll use a neutral word, with public health about issues. Is that the problem of statutory versus voluntary sector, or is it something more fundamental about what you believe is the appropriate way of addressing issues?
I think it's probably something more fundamental, to be honest. I think it's there's a huge amount around just the language we use. We don't speak medical speak. I mean, English is my only language, and there are times when I reconsider a conversation that I realise that we've both been talking about two different things. So it's about, looking for some kind of translation service where each profession recognises and values the other.
Let's take Maria and then Marianne.
I think there might be just a huge difference between public health and public health. We have experienced in Haringey such incredible support from public health. We as a community organisation, we have been the only ones. There's a lot of other community organisations that get support from public health. My role has been sort of one day a week with public health, just to strengthen that relationship and to be able to develop programs that involve different kind of community organisations. For example, health checks now, there's drug and alcohol organisations, and I do believe, and I agree with you, that's the only way forward, that kind of partnership. And it is possible. I think could it be just individual based? I don't know.
Yeah, just to respond to that, as someone in public health, I recognise what you're saying. I do think there's sometimes a real snobbery from public health professionals, and I am one, and sort of lay people. But I think that's not common across all of London, and I think we need to break that down, as Maria is saying. And in Haringey, we certainly commission a lot of things that are peer-led services, and I mean commission, we pay people. We've got peer mentoring services for people that are former drug and alcohol users. And obviously what we haven't mentioned is the Health Champions scheme, which is a national thing. Again, we support that. I think there's huge, we could be doing more with that, with a variety of communities. And I think in terms of health inequalities, just to name them, the biggest ones are alcohol, smoking, and if we don't work with communities, we're never going to change those kinds of behaviours. And that is the evidence. So.
And your expertise as a community organisation is just so
crucial.
valuable. You are the only ones, who can really reach those people that public health sometimes in ivory tower can't.
I'm going to go to the audience in a moment. Marianne, I'm just wondering, smoking, exercise, we would all recognise those issues, but Eleanor raised isolation as a huge issue, and certainly recent visits with big healthcare providers, especially amongst the elderly, this is really becoming a dominant issue. And when we look at the demographics for the London Health Commission, not only have we got a significantly increased population in London in the next 10 years, but we're going to have a significant over 65 population, possibly for the first time. And I wonder how well, if at all, London's health and social care services are set up for a fairly significant change to the demographics, in which case it might not be smoking that's the biggest public health issue.
Again, I should have mentioned, it's one of the other projects, again, it's all time-limited funding, is we've got a commissioned organisation called Living Under One Sun, which is a community-led organisation, and they've got a connectors project, and they go out to elderly people in the community. And some of that is around social isolation, but some of it is that they are picking up alcohol problems in older people, which is often hidden. Sadly, that funding is not mainstream, so it's a project. But again, in terms of taking things forward, I think we're going to need more outreach services. We're going to need to connect with people in their homes, and that relates to physical activity in the broadest sense, because if you're connecting with people, then you're getting them out of their home. So I agree. I think we need another way of working. They're not going to turn up to hospital, or if they do, it's often too late. So.
Well, I'm going to come on some other people, but John, we might come back and discuss urban design issues around isolation and other health issues. Philip, and then we'll go to the audience.
Yeah, just to build on Eleanor's points about the community settings, we think that's absolutely kind of essential within this kind of broader solution. So whilst you support a general age group in the community here, we know we've got 400 members who support that work in communities, supporting young people throughout London, in every single London borough. And we think that what we would call kind of shorthand youth clubs are great settings from which to engage people in health, because they're places embedded in the community, and most importantly, they're places where young people choose to go. And that helps them build trusted relationships with the adults, the youth workers there, and from there lots of solutions can take place. So I guess we know some of our members are doing some work explicitly around health, but for those who are not maybe doing explicit work around health, empowering, training, building the capacity of youth workers to be mindful of the solutions and the kind of more holistic picture around them, of which there is a lot in London, can help build part of the picture, because you can start identifying needs with young people and signposting them on to perhaps the health professionals. We also think that specific health interventions, programmes as we would call them, delivered with and through youth club settings can be extremely powerful. We deliver a sports programme that engages young people who are not active in sport, because they might not engage in sport in a school setting, it might not be for them. They might not trust the teacher, it might not be the right environment, but in a youth club with their friends and with an adult they trust, it's much more likely they can choose the kind of sports that they're interested in and build a pattern of behaviour that leads to better health.
I think that's sort of building on Phil's point, from working with Tottenham and stuff like that, in my role as a sport development officer, is co-designing the programme. So we're talking about sort of health professionals. Well, youth workers are professionals as well, and I think sometimes there's a feeling that they're not treated like that. We get to teachers and then we don't consider youth workers as professionals. So the success of our programme, we've reached over 7,000 young people aged 8 up to 25, is because it's co-designed with sort of our partners in each borough, the youth workers, the young people at the club. So I'd certainly welcome, from sort of the health point of view, is actually working with people like London Youth and others around the table to sort of, you bring your expertise to the table, we bring our expertise. And, we've got, as Phil said, there's a vehicle of 400 youth clubs out there who can really drive forward this agenda.
Can I just ask a question about sports? Because one of the things I'm aware of is a debate about, I guess, disappointment about the Olympic legacy. And people are saying, sorry, do you...
There were some people in the audience who wanted to come in, I think, specifically on the issue of isolation of the elderly. I wonder if we should finish that up first before we come back to sport. Would you mind?
Fine, okay.
Is that okay? Who wanted to come?
Sarah Dugan, Assistant Director of Public Health at Camden. Oh, thank you. Sorry, Sarah Dugan, Assistant Director of Public Health at Camden and Islington Councils. Just to respond to Eleanor's points, I'm afraid I don't know what the relationship was or what's happened between you and the public health team in the past. But what I can say is we do fund a lot of voluntary and community sector organisations to deliver projects, and we are very committed to supporting the voluntary and community sector. We do really value the importance of all the work around social isolation and what it does for older people and their health. Just in terms of evidence, I think the difficulty for us in public health is we're always asked for very hard evidence, so numbers and counts. And I think we're beginning to realise, and we're putting more investment into looking into kind of qualitative research, and I think that's really important. So what do people think and what are residents' views, rather than just a number of people accessing a service. And we'd be more than happy to come and work with you and help build up that evidence to help support you get funding in the future, and then also to look at what we could potentially fund as well.
Very helpful, thank you. And now we're going to hear from a CCG chair.
Hi, I'm Gillian Greenough. I'm Islington CCG chair and a GP. I just wanted to speak out about some of the things that we've been doing in Islington with public health, and I've worked with Sarah for years, and it's only recently that Islington and Camden Public Health have merged. But I would like to say that certainly in Islington we've been really trying to work together, and one of the exciting things I think for being a CCG is that actually we've really put an emphasis on working together, because actually what we've seen in Islington is that unless you value absolutely every part of your community, you are not going to make wholesale change. And, you know, if somebody isn't in the right place to change their health, they're never going to. So we're now part of the Pioneer project, and a lot of that is about, you know, kind of working with people when they're ready to change. But obviously, your kind of organisation supports them when they're at a time when they're not ready to change, when they're often at their lowest ebb, and then they kind of get company and feel better and might actually make changes as a result of feeling better. So we've recently introduced two navigators for our long-term conditions, both of whom are employed by Age UK, and we purposely only advertised it to the third sector, and those people help to link people into all the resources in the area, and you know, kind of, it's really exciting what we're seeing actually.
Thank you very much.
Thank you very much. Pat Callaghan, Councillor and Chair of the Health and Wellbeing Board in Camden. I think the beauty of this centre is that, unlike other centres, it's not just for one age group, it's not just for the elderly, it's a total intergenerational centre, and that's the beauty of it. It is one of the best in London. If you see older people, the children are playing out there in the drop-in centre, the older people are in here and they come alive, because lots of older people in Camden don't have their families around them. Property's too expensive, they haven't been able to get social housing, so the families are broken up, and mum or dad or gran or granddad just see the families maybe once a month, once every 2 weeks. It's not good enough. There's no popping in like there used to be. And I know Alex and his organisation have taken up a lot of that. But this centre is totally intergenerational. I got a lot of flack for closing luncheon clubs, as they said. Well, none of them have closed because people have sponsored them. But it's not just, there's no luncheon club here, yet it's one of the most successful, as I said, in London. It's not about food, it's about the interaction, it's about meeting people of different ages and becoming part of that bigger, holistic family. So we need more centres like this.
Thank you very much. Jeremy, should we move on and go back to sport and youth, I think?
Yeah, I mean, I suppose the question was, it seemed, people are saying that we haven't, you know, delivered on the Olympic legacy in terms of increased participation in sport. If anything, it seems to have gone down. Do you agree with that assessment? And if it is right, or even if it's not right, what do we need to be doing in London that would kind of ramp up the level of participation of young people in sport and physical activity?
I'd say, well, from the legacy point of view to start with, we have, as an organisation, we have benefited directly and have been able to benefit thousands of young people because of the Olympics. We received an investment of £250,000 from Sport England's Community Sport Activation Fund to deliver and continue delivering our sports programme. So that has been fantastic, but I think it'd be slightly naive of us all to think that because we've got this fantastic stadium and stuff like that, that the Olympic legacy has been achieved, because for the young people who are out on the pitch there with Steve from Arsenal and stuff like that, you know, the stadium doesn't mean anything to them. It's what happened in Monday, Tuesday, Wednesday, Thursday, Friday, right in the heart of their local community. In terms of participation rates, we actually haven't seen a decline. It's something that we're continuing to see grow all the time, and that's, I think, purely the reason for that is actually it's not us as London Youth or as adults deciding what sports young people are going to want to do. Young people are involved in the decision making about what sports they want to see. We work with national governing bodies and a whole host of different community partners and sort of on the ground people to deliver a programme that is right for that young people. So our sports programme works with 100 youth clubs across London. Each of those clubs has a different programme. The model is sort of the same, but it allows flexibility to ensure that what's right for the guys in Camden, maybe down the road in Islington, is completely different, or even clubs in the same borough is completely different. And because we work with such a broad range of sports as well, so we've done these sort of traditional sports, but we've also worked with everything from Zumba, ultimate frisbee and stuff like that, and it's about pushing young people, challenging what they perceive as sort of, you know, their barriers and stuff like that. Working with the older young people, developing them as sports leaders. So that's something that's worked really well, that sort of peer education type stuff. And that's something that, you know, I certainly think could work in terms of developing young people as sort of maybe like young health leaders and stuff like that, to actually give them the basic skill sets to actually then, you know, pass that information on, because a lot of the time, you know, young people are a fantastic vehicle for communicating and stuff like that.
So not to put words in your mouth, but co-design and local flexibility might be some of the key principles towards increasing participation in sport. But perhaps the traditional way is just to have a template of things that are available and people, either do them or not, and that isn't such a good way of engaging. Is that?
Yeah, I agree. So the model that we've developed through our Getting Ready Sports programme is now sort of looking to be sort of developed nationally with other youth clubs and stuff like that, and that's something that is being considered for funding because it's certainly not rocket science, but it's a model that works for local communities, and I think that's sometimes been the challenge with certainly sports funding in the past, is that after a 2 or 3 year programme, you've got your evidence. You've got something that really works, but the next round of funding and stuff like that then asks for you to recreate a whole new programme that tries to do something different, and actually you've just spent 3 years and a lot of money and a lot of time building up a really strong programme that's making a hell of a lot of impact for young people, but we need to slightly change that again to keep going. And like everything, it's a chicken and egg situation, and a lot of people in the room have probably been, and you do it because we need the funding, but are we actually really helping those young people out?
David, that's it from you.
Just to build on that point, I think that the principles of involvement in sport are the same as the principles of involvement in anything, from a community centre to kind of in a service user in a service. And for us, the key to that is what you're saying around co-design, but also co-production. And I think that would be one of our recommendations, would be that the London Health Commission can provide a broad series of principles for how community development can be integrated in statutory services. So we work across our programmes have to work at all levels, so they work across the statutory, voluntary, and also we bring in the private sector to run to offer spend for our time credit programmes. But often we're working against a culture that doesn't really support that kind of. It's almost the next level of integration, isn't it? You've got health and social care, but community isn't quite in the mix of that yet. Social care services are often in communities, but often blocked. Not really in the communities. A lot of what we do is to try and link social care services into the community, but then health is completely separate from that again. And actually, if we had some broad principles that were guiding how we were working in London around, there were basic co-production principles on working in a mutual way, building on reciprocal principles, in partnership, building on co-design. And it's this clash, isn't it, that we sometimes think between flexibility and top-down approaches, and how we can approach that in a way that allows very local solutions, but with broad principles across the top that guide us, but don't force us into working in certain ways that don't work for certain groups. Because here we're talking about dozens and dozens and dozens of areas, but we're also talking about lots of different client groups, service user groups, and then all the people we call the public, who of course are also those people. And it's we do need some very broad principles, I think, that guide us through that, but don't force us to work in a way that doesn't work for people. When we ask them what they want, we need to be able to follow through, which is the classic problem with consultation. We often can't follow through from what we ask people. What do they want to do? And I think that's something that I think the Health Commission can really help guide, are some of those very broad principles. And I think the principles of co-production are very, very useful in that, and which is, I think, what we've been talking about here. I think everyone is talking about co-production in their own way.
There is a bit of it feels like an emerging tension between the theme around co-production and really listening to people's needs and long-term engaging with their needs, versus as the funding climate gets more and more tough, being more and more data and outcomes driven. And one of the things that the Commission's been looking at is how we might enable funders to move to a more outcomes-based funding model rather than focusing on the process or the inputs. I'd be interested in hearing your views on that.
And we have to remember that co-produced services and co-produced everything, they are more efficient, and they do provide better outcomes than non-co-produced services. There is a lot of hard evidence that supports that. That when you ask people to design a service and participate in a service, they will continue to participate over time, and it will also involve other people as well, because they'll be in a service or a club that they've chosen to be and they've probably helped make. So I think those things can come together.
I can just say there's something else that came out of the discussion here that John was explaining, which is that the tendency for funders to fund things which are time-limited projects rather than a mainstream programme, and to keep changing the rules. which I think is, we all recognise that it happens in all public services, and it seems to be a huge source of inefficiency. And maybe one of the emerging themes for us is, in a world where there's less money, we ought to be spending less money in that kind of way and more money on trying to embed an ongoing, continuing approach that is continuously improved but not torn up by its roots and completely changed every 3 years, which I think can be disastrous.
Forgive me, I don't. Could somebody just explain where your funding comes from mostly and how?
From a sports development point of view, it's the core fund is from Sport England, and then
and that's short. Is that short term?
It's 3-year funding.
3 year.
And then we've been fortunate. Our programme is in its current sort of format has run since 2009. So we've been fortunate certainly to secure ongoing funding every 2 to 3 years. And that's also down to the hard work, I think, of the team, but also of actually, the work of the youth workers and the young people on the ground, because the model works. And in the end, I think, as a sector, there's also traditionally we've been maybe poor at sort of evidencing the impact of our sort of work, not just from a sports or health point of view, but generally. And that's something at London Youth that we've now put in basically a journey of change model now attached to all our programmes, and an impact sort of model. So actually now we can start to capture the real impact of what youth clubs, for X amount of money, this is the impact that's going to come out of it. It's very new to us as an organisation, so it's a huge shift of culture and for the whole sector. But I think we're trying to lead on that because we recognise this is the way things are going. We know that we can all give anecdotal evidence, but as you say, funders at the moment, for them, anecdotal doesn't cut it. So we need to be able to provide hard evidence with that.
I think that fits well with what you were saying about outcomes, in that it's understanding the changes to people's emotional and social capabilities is an important part of this as well. And there was an interesting report last week from New Philanthropy Capital around Wellbeing, and saying that yes, there might be kind of extrinsic outcomes you're measuring for health or participation or employment, but actually understanding people's resilience and their confidence, their ability to form relationships, is really, really vital, because without those things, you can put in place the best programmes leading to what you think will help people. If you're not resilient and confident, then you're unable to take those things forward.
Just to say, in terms of impact of youth work, good quality youth work can take years for it to actually have a real impact on a young person's life. So we're working with lonely, isolated older people, the impact can be evident much more quickly. It can take years before the full impact of such work can be established.
Can I say something very quickly? I think the thing that is amazing about cities is that they're full of all sorts of different people, and they're dynamic, and they move, and they change, and we as a voluntary sector and the healthcare sector have to change with them and be dynamic as well. But that they've got all of these different demographics of people. They've got young professionals that we work with to support their older neighbours who might be isolated. They've got unemployed people who might have spare time to do things, who can help out in the local community. They've got middle-aged people perhaps who are at different stages of their life. So all of these people come together means that yes, some people are very isolated, older people perhaps especially, and there's a perfect storm oncoming for a generation of older people and an ageing population, but at the same time there are very well-connected people right next door to them who have the skills, the tools, the resilience and the networks and the relationships within their own social networks to be able to support those older people. So that's what we try to do. We match young professional people who are very well connected, high-flying graduates in consultancy or media or law or whatever it might be, and we match them to people who might be isolated to, in both instances, bring out their humanity. And we don't ask accountants to come and be accountants when they volunteer with older people. We ask them to come and be themselves and use their humour and their sense of play and the really nice, easy human things that we all take for granted, but are the things that make life worthwhile, because accountancy doesn't make life worthwhile so far as I can tell. And bringing those people together to share skills, to share new experiences, to share cultural exchange, because it's not just the kind of really rigid co-production is the word that we're using, but a kind of a healthcare solution that is going to solve what is a social problem on the ground in communities. It's got to be people using people skills. So that's what we try to do. For example, we took 16 pensioners, 5 volunteers, took 16 pensioners to the Emirates to watch the game on the big screen on Saturday, and there are people older men who are particularly isolated and could be particularly proud and don't want to come out into community activities. Football is a great unifier, and I think particularly for some men, and particularly a specific generation of men. And these guys had stood on the North Bank for their whole lives, but had never been to the Emirates, and didn't ever think that they would get to go to the Emirates, and they get to go to, albeit it's not the cup final because the cup final's at Wembley, but they get to be in that atmosphere again, and they're surrounded by people again. And it brings out the sense that you use the phrase come alive, it makes them come alive again. And I think so emphasising the humanity of people and what they have to contribute, whether that's a young professional demographic, young children with older people, whatever it might be, and bringing everybody together is really important. And the voluntary sector does that very well and is almost the only sector that can do that. But at the intersection of the voluntary sector with the public sector supporting it financially, and also business as well, which is where people do genuinely live their lives. People go to shops, restaurants, cafes. So bringing in businesses to host some of these activities, particularly as some community centres might not be around in 10 or 15 or 20 years' time.
Alex, do you get your funding from businesses or from statutory organisations, or a combination of both?
Combination.
Combination.
Yeah. We've got some corporate partners that have given us some money. That's quite ad hoc, but to be honest, our public funding is quite ad hoc as well. As you were saying, we've never had any 3-year funding, but at best we've had 1-year funding, or 2-year funding now from Camden Council, which is amazing. And I know it's very difficult for statutory authorities to give money really beyond that, because they don't know what their settlements are going to be from national government. But certainly some certainty would be hugely valued, I think.
Thank you very much.
Andrew, one question.
Before we come to you, I think the gentleman in the audience just wanted to come in on that issue, John, and then we'll come to the design issues.
I'm Greg Battle. I'm a medical director for integrated care at Whittington Health and a GP in Islington. I just wanted to ask 2 questions of the Commission around income inequalities. Obviously, health inequalities to some extent are a proxy for income inequalities to a significant extent. And often when we have these debates, yes, by the time people are seeking care in an acute organisation or indeed in primary care, they've already had the impact of years of income inequality. And one of London's sort of characteristics is a very rich city, and what the Health Commission might be able to say or do about addressing income inequalities, I think would be an important part of what will come out of this. And the second thing I think is we here are not very representative of the multicultural nature of London, and another key factor of London's DNA is it's a multicultural place. More than 50% of people in the last census are not from London, or possibly even from the UK. I can't remember the figures. But another big barrier is access to services and so on, not only statutory but otherwise around that. So I think somewhere in inequalities we've got to have something around multiculturalism, or addressing the needs of different groups, recognising that's a key part, long-term element of London's triumph, success and joy, as well as managing the extraordinary health income inequalities that we have in London, which are also one of its great joys, but has a serious impact on how people experience their capacity to access services and so on.
Thank you. Jeremy, do you want to comment on any of
Yeah, I mean, I think that many of us, I think, on the Commission would kind of share the view that in order to have something really crunchy to say about health and care in London, we also need to say something about the wider determinants of poor health. Yeah. So we have talked about income inequalities, poverty, and the other kind of social and economic aspects of London. I guess the key question really is, because this is a commission that's been commissioned by the Mayor, what is the role of the Mayor and what can he do that would make a difference? That's the kind of big exam question for us, which I think we hope to provide some answers to, but I don't think we're there yet. But certainly some of the possible components around that, for example, the importance of the London living wage and whether there should be more beef around that. That's one of the things that's been discussed, but I don't know what we'll end up saying, but I think we will certainly want to say something that recognises it's not just about the NHS, it's about people's actual lives and about social and economic factors. On multiculturalism, I think that one of the big themes has been the recognition that you can't have a single solution for London, whatever that might be, largely because London is so diverse. So I think one of the other currents of conversation so far has been, you need to be sensitive to different communities and their different characteristics and capacities and needs. And actually, some of the conversation we've had today about community development and about local flexibility, I think, is part of the way in which you hopefully will address some of the issues about diversity and how you can't have a single top-down solution. So I think that these are very, very good challenges, and I think we're aware that we need to have things to say in response to them.
Just build on that, certainly having sat through a couple of discussions, just a couple of examples. I know there's been quite a vibrant discussion, for example, about the role that we might play using planning, local authorities might play using their planning powers to help regulate fast food outlets, chicken shops in particular, which are immensely dense and prevalent in very poor areas. I live in a poor area in the East End, and it is truly remarkable trying to get as Yvonne Doyle would say, trying to get a child home from school without stumbling across a chicken it is almost an Olympian task in the East End. So we have talked about that. We've also talked about the role of the NHS as a very big employer in the city and what aspiration we might set around committing to the London living wage. I know we've got a couple of Trust Chief Executives here and they might want to comment on that. Of course, we have got huge economic pressures within the service, but I do know that some Trust, Barts, for example, has already committed to paying the London living wage, has introduced that. I think they employ about 16,000 people. So we need to think about our role as a large and potentially exemplary employer in tackling some of these issues. David, do you want to come in on that?
Yeah, I think, so I'm David Sloan, I'm the Chief Executive, I'm David Sloan, I'm the Chief Executive of the Royal Free Hospital. I think as hospitals, it's not just our staff, it's our relationship with our suppliers and our contractors. Yeah. So there's a whole supply chain that we can influence about how people behave around issues like the living wage. The other issue I'm interested in is our role as employees in terms of promoting the health of our workforce. Yeah. And I know that we've been around these laps many, many times, but there's a question for me about, is it time to take that step change up in terms of how we address those issues?
Thank you. And to your right.
Hi, I'm William Roberts. I'm from Camden CCG. I'd just like to pick up on Dave's issue of the supply chain, because I think one of the things that's really interesting in the conversations about how we value the voluntary sector is often the conversations I have are about people coming to the commissioners having that conversation. And I think there's a really exciting conversation potentially between hospitals, community trusts and voluntary sector. Just to give you an example, I've worked for Camden CCG for 2 years. We've existed for 1 statutorily. I'm on my 6th commissioning organisation since I became a manager. We seem to get reorganised on a reasonably regular basis, and therefore the funding changes depending on which idiot like me you send along to the public meetings. Whereas Royal Free's been here 150 years. UCLH has been here a little bit longer than that. Our community trust has been here a lot longer, and I think there's a really exciting potential to link up voluntary sector providers to be part of the supply chain to our big providers, because actually that in itself, those organisations will be here long after I go. But I think there's something exciting about that conversation potentially as well that's often missed. It isn't just about coming to the funders, it's about going to the place where most of our money goes.
I think these are really important points, and one of the thematic areas that we've discussed many times is where we see other global cities like New York taking quite an assertive and an aggressive role in using all their statutory powers, but their influence, but also things like their supply chain to set standards either around income or about the role of community groups or nearby suppliers, etc. And I suspect there's going to be quite a strong theme of recommendations come out of the Commission about us using the interest that the Mayor is showing in this issue and the convening powers of the Mayor, and the fact that many Londoners actually think he's also in charge of health, even though he's not, to bring some of that power to make sure that London is exhibiting the same kind of energy as some other global cities behind this issue and tackling all of those issues that have just been raised. Ron, did you want to say anything from a trust perspective?
I mean, I think the point in a sense has been made by David. I think the trusts there's often seems to me to be a view that somehow the hospitals are separate from the community, and I think the hospitals have got to be, if they're anything, have got to be lodged in the community. They are, as somebody said, usually the biggest employer locally. They have huge impact on, therefore, on the well-being and the health of their community, not just because of their direct workers, but because of the impact those workers have on influence within the community and whether within their families or their friends or their wider relationships. I think the procurement route is really important in terms of changing the whole attitude towards healthier means of production, healthier means of delivery. And I think we underestimate the influence we had. David and I are both actively involved in the London Procurement Partnership, and I think that the sheer scale of that partnership means that we've got the potential to have great influence, I think, in way outside healthcare and outside social care. But I think working together with local authorities to think about, and indeed universities and other major public sector organisations to think about how we can actually get real traction in these areas is very, very important and a key part of our role. And I think hospitals do need to see themselves very much as within their community rather than separate from the community.
Great, thank you. John, I wonder if we might move the conversation now on to slightly kind of more environmental issues, if we can.
Yeah, it's fascinating listening to all this stuff this morning, I must say. And actually, I keep thinking, well, where will I start in? What shall I key off? What people have said. But if we can just, a couple of things that have just been said about what the Mayor has got responsibility for. You know, he doesn't have responsibility for health, but he does have responsibility for the city's planning and the city's transport in a variety of different ways, through his London plan, through his transport strategy, through funding all the local boroughs in terms of what they do. And I suppose there's another aspect, which is this idea of there being no single solution for London. Well, I mean, it's interesting because I represent in a say, or I work for people who won't join anything. They don't have to come to a centre, they don't have to be contacted, they're just out there. It's absolutely everybody involved in just getting around London. And actually, I think it's very easy to overlook that. It's an interesting point about the evidence and the anecdote. One of my favourite anecdotes comes back to something Eleanor was saying, was when some work was done to make, doing some home zones, as they used to be called, basically making local residential areas much nicer and easier to walk around. And there was a great anecdote, which is one of my favourite stories. This is a relatively old lady who, at a consultation meeting afterwards, said, "See, my journey to the shops used to take me 5 minutes. Now it's wonderful. It takes me 20. And the reason it takes it 20 is because she's in an environment where she can stop and chat and talk to other people. So there's that level, I suppose, of that contributes to the issues about inclusion and exclusion and isolation. But also, I'm a trustee of Living Streets, which is the pedestrian association, and this walking month is May, and there was a big this walk to school week. This week is walk to work week last week, and there was a lot of media about the walk to school week stuff last week about how people travel to school. Obviously that's changed quite substantially for a variety of reasons, but I was reminded of, again, another anecdote. We'll say it's not even an anecdote, it's just a joke from Al Murray, a pub landlord, where he once said, the parents drive their kids to school to stop them getting knocked over by other parents driving their kids to school. So we will end up with a generation of flat-footed, asthmatic kids with no sense of direction. And actually, at the humorous level, that's exactly what we're talking about. And as I say, what I think I represent is, in a sense, a lot of damage we can do, or actually create a lot of customers for organisations and centres and the health service, simply because of the inability for people to choose every day in ordinary ways to travel actively. If you don't mind my saying Maria, I was stalking Maria as she arrived this morning. I saw, because as I walked in here, I saw this lady with her bike doing that, which I've seen a number of other places, which is, I've come on a bike and I've no idea where to park it. And the moment Maria's parked her bike just underneath the railway bridge there, on the back of what is actually a stand where you're supposed to park your motorbikes. It's under a bridge, it's relatively dark. If that bike goes missing, or a different time of day and it went missing, somebody else has lashed their bike to the railings here as well. In other words, not where there's provision for that. If that bike goes missing, or even just because it wasn't a great experience, maybe Maria won't ride next time. Maybe she'll use a different form of transport. Even at the level of, if I might say, that the invitation to this that I received, how do I get to here? By underground, by bus, by car? Why is anybody even remotely suggesting this is a great environment we're all Londoners to come to by car? Nothing about where the nearest Boris bike stand is. Nothing about actually, you know, stuff like that. Well, exactly. And I think I'm only using that as an example of the fact that actually it's these ordinary, everyday ways. There's deaths by 1,000 cuts thanks to people like me. And I think one of the things that's very important, in a way, I think the health business, if I can call it that, sector has got all the evidence we need. In other words, the benefits of walking more, the benefits of cycling more, that's fairly established at the physical health and I think at the mental health level, the isolation. But a lot of what will make people isolated or not walk is in the physical environment, which is created by people like me. And if we're obsessed by moving traffic around, because that's where our political pressures come from, then where we could, and there's loads of money around, to be honest, there always has been in my sector, still is in London, for creating better streets. It can be spent one way, it can be spent another way. At the level of planning, where do people live relative to where their schools are? When there's a new development, is there any school at all nearby? What will it take to that? Or other community facilities, or shops, or this, or that, or that. We are capable of basically making the health sectors, well, keeping them in customers for ages, simply because in ordinary, everyday, bog standard ways that affect absolutely everybody will make it less attractive to walk or to cycle. And I should say on that as well, when things are, where relatively short journeys are unattractive to walk and cycle, that also affects whether people go to use public transport or not, because there's that journey to the station. If that journey to the station is very complex, awkward, you wait and wait and wait and go through several sets of sheep fences, as it were, to get to where you're going to think, oh, do you know, next time I'll go by car, or something like that, or I won't go out. You know, so that leads to isolation as well. And I think there's a huge amount that actually we're in danger of overlooking, simply because, as I say, in a way, people who deal with planning and engineering the streets and transport systems here, it does affect absolutely every Londoner. There is an opportunity there to affect every Londoner, rather than encouraging people there because they don't get the everyday exercise, so they'll drive to the health club to get on a treadmill, you know, that kind of thing. And only a certain number, only a tiny number will actually do that.
John, we've seen from other global cities that we've looked at some inspirational examples of I suppose, pedestrianisation, not de-urbanisation, but certainly removing cars, turning streets into active places where people might want to walk, or set up a cafe. So quite a profound economic impact as well in terms of drawing small businesses to the area. Do you think the mayor should be more aggressive on this kind of agenda for London?
I think this mayor, in this mayorality, probably won't be. But I think in policy terms, you look at all the words, they're all there, but they're slightly compromised by the fact that, well, we're going to make it easy to walk and cycle. And I should say, one of the interesting things that I've heard from this morning, which is a real challenge potentially for any sector, is this idea of short term. You know, 3 years isn't actually that much. What do we do after 3 years? I was at a conference on cycling recently, and on behalf of the nation, somebody said, look, there is no cycling budget. You know, there's just a 2-year thing. Now, actually, probably London is one of the few places where there is a cycling budget, by which I mean there's a 10-year commitment to spending about 100 million a year. And that's great, because that actually is quite new money. But how will that money be spent is a real challenge. We are perfectly capable that if we're not really on the case, if we're not really motivated in the right way as a profession, we are perfectly capable of spending all that money, but in ways that won't particularly help. Right behind here is quite interesting, a lovely old cut through for bikes and walking. If you come under the bridge, it used to be part of Hawley Road that was public general access for everybody. The vehicles have been excluded, so there's a nice little cut through that's just for walking and cycling. Rather awkward junction there, and then it falls apart completely as you get into the gyratory. But once you get across and through there into Royal College Street, there's a pretty good cycle track the council at Camden have just improved, and they're looking to extend that at the moment. So, you know, there's some good evidence that you can join it all up. I think the mayor is doing quite a lot here, slightly, as many many transport authorities are, and this includes the boroughs, never quite sure how to, you know, basically, yes, we'll do all of that, but actually the moment we sound like we might make traffic congestion worse, we know what our postbag's going to look like, and we'll step back from that. So it takes bravery rather than aggression, I think.
Well, it's difficult to imagine how we're going to fit another 2 million people in.
It is. I mean,
unless we slightly change our attitude towards London roads.
Of course it's not, because if you looked at the news last week, Boris has floated the idea of this inner orbital tunnel underground for 30 billion. And that's how we sort it. Which is, I mean, I dare say he's floated it just to put it out there and get it kicked, because it's nonsense. And actually, but what it does show is, with all the growth and all that, we have to think backwards from our end state. And I love this idea of outcomes. I think it's absolutely essential. Why would we spend it? And the outcome for London needs to be, what kind of city, just for everyday ordinary, moving around, nice place, all that sort of stuff, the things that people really enjoy, that actually all that anecdotal evidence, what do we want our city to be like? We have to work back from that. And actually, one of the reasons for that the inner orbital tunnel thing, which I shan't go into detail, but you'd have a look at it and understand why I think it will never happen, is we're frightened to death about the growth of the movement of transport. We are sort of assuming, or rather this comes at the trying to have a cake and eat it. We don't have the confidence that we can reduce proportionately very much the amount of car travel, so we'll have to build that tunnel. We could start from the other way around. With that much movement, with that much travelling, how many people are we going to have doing journeys they currently go by car, on a train or a bus? How many people currently on a bus could walk or cycle, and so forth, and work back and design our city on that basis? That's a big, big move, and maybe the next mayor will take it on.
Great, thank you. Alex?
Yeah, let's start something very briefly to what you were saying. I loved your anecdote about the woman whose journey was extended from 5 minutes to 20 minutes, and how that's a good thing because she was interacting with people on the way. Yeah. But at the same time, I got on a bus the other week, and you don't have to look at or speak to the bus driver. I choose to, but a lot of people don't. You put your Oyster card on the thing, you go through, you can go to a garage and buy a coffee without interacting with anybody. You buy it from the machine, you buy a train ticket, you buy it from a machine. You go in Sainsbury's, you go on the self-service thing. There's 31,000 self-service counters in the UK, which is more than all the other countries in Europe put together. And we're talking about loneliness and a big city which can be discombobulated and people can feel isolated, and yet we're choosing not to interact with people. The service system and consumer economy that we've created is such that people are not choosing or opting in to interact with other people. That has massive implications for loneliness, I think, particularly amongst older people who feel like the pace of change in the world is accelerating beyond what they're comfortable with. There was a news article recently about a woman who went to Dignitas because she felt uncomfortable with the pace of change in the world as well. So I think all of these things, when you're talking about this, more than just transport, it's how we build our consumer economy to make sure that people aren't isolating themselves from other people.
There is a risk, isn't there, that unless we change our framing of this, you end up with things like everyday automation that actually might increase efficiency but increase isolation, make the city a more harsh place to live, when the technology is really there to help us enrich our lives.
I agree. On the other hand, I thought it's a very, very good contribution to the debate, which I think is how do we work back from the city we want? And we don't often get to do that, but we do at that London plan level. We do at the Mayor's transport strategy level. And obviously can't deal with some of those issues, but actually we can create environments. One of the biggest challenges we have, sorry to go on, just is that actually you speak to most local high street traders, they are obsessed by car travel. If you move a car parking space or close one down, that's it, their business is going to fail. Study after study that Transport for London has done shows that across a huge range of London town centres, walking wins easy, hands down, every time. Cycling's not far behind in terms of over a period of time. How does your till receipts get home? Okay, on foot, and some by car. It's very impressive when somebody fills their boot up, which is what, but they only come once every 2 weeks as opposed to people who come every 2 days. There is good evidence, and I think we have to use that to be brave about what our transport and land use policy for London will be to create a city that we want to work back from, as it were.
Great, David.
And for me, I think that does link exactly into health and social care in the way that we design a service, because I think we need to think, like you say, from where we want to be, and thinking about some of the most vulnerable people in London. They don't receive the services that they want to receive. So we completed a piece of ethnographic research last year around people with very, very complex needs around learning disability and mental health. And most of them have not been into central London, have not walked down the street recently, smoke incessantly out of anxiety or afraid to leave. And that's before they might walk to a park or access any of the things beyond their door. But I do think these things are joined. And I think the support worker should have that same sense of what we mean when we talk about a vision for our streets and for our transport. I think that should be shared. And I think that is what's missing, because you'll have the wide public accessing these mass kind of transport things, but we do still have thousands and thousands and thousands of people in services who probably don't need to be in long-term services if we were designing communities around people and around mutual support, peer support, around streets that felt safe. And I think it's about connecting the dots about where we want to be. What is it like for someone with dementia? What's that ideal world look like for them? What does it look like someone with a severe mental health problem? How do we wrap services around people? But then how do we kind of get beyond this idea of services and automation and think about actually who knows their neighbours? Would we knock on the door if we knew someone was bereaved 2 doors down? If we saw the hearse pulling away some morning, we'd be very unlikely to do that in London. And I think it's about joining that with mass transport and thinking about both with the same ambition, about the lives of the very, very vulnerable, as well as how we think about how we get millions of people to work every day. And for me, that has to be the vision of the most vulnerable, as well as the mass the mass things that we need to achieve for a city of this size.
Just on the transport system, I'd be interested to hear what other people directly working with young people think, because coming from Wales originally, I presume getting around London would be easy, and my whole job is travelling around London. But actually I work with a lot of young people. If you ask them to go maybe half a mile away from their comfort zone, it scares them to death, and they will not leave that, and then they miss out on opportunities and stuff that life can give them within their own locality. Even to the point where I think, use TfL. I think for a lot of the young people, they wouldn't know what that is, so maybe needs to be some education around that. But I also think it comes down to the youth workers and stuff as well, because I think there's also the youth workers stuff, there's a barrier sometimes to them, but they've grown up in the same thing, so it's just generational that transport is just, they just stay within their locality. Going and exploring London just doesn't happen, and they miss out on so much, I think, because of that. So I'd be interested if that's the same for other organisations.
In terms of this thing, I think that's really important, the same thing as well, because I'm a real believer that transport is just a means to an end, and that's this idea of what is that place, what is that community like, what is the city like, how do we broaden people's horizons. The besetting sin of my profession is the fact we see creating transport as a kind of means in its own right. Nobody travels for the sake of it, hardly anybody. Right? It's a means to an end, and how do we harmonise those two? How do we embed that in the lives of ordinary people? I think is critical.
John, very quickly, I took a kid on a day's work experience a year or two ago from a school, Holloway School, which is near to Caledonian Road, lots of estates around there, and I collected him from school, walked him to the tube station. He'd been given a day's travel card by his school. I went through the barrier first to show him, and he just stood on the other side of the barrier with his ticket in his hand and went, "What do I do with this?" And I said, "What do you mean?" He said, "I don't know what to do with this." He'd never been on the tube before in his life. He's a 15-year-old kid who lives in the middle of London, never been on the tube before in his life. So when you use the word about horizons, more than just opportunities, the opportunities are there, but the horizons aren't, to mean that they know what those opportunities are for them.
One of the projects we run with older people is just to support their use of their freedom passes. We meet here and go to all kinds of venues across London that are usually free entry, and the day out doesn't cost them a penny, but they would normally never use their freedom pass, but at least it gets them out. It's
a tiny reminder that for a lot of the communities in London, the community is 2 blocks around, isn't it? Whereas it may not be for some of us. Sadly, we are out of time. Just before I conclude this session, is there any other burning contribution or recommendation that anybody who's been kind enough to come and talk to us today would like us to hear before we wrap this session up?
Just add one other thing. We talked about the physical environment and how it affects physical activity, but I think there's the issue around planning in the wider sense around, there's no coincidence that the proliferation of fast food outlets, betting shops, payday loans, they're all in the most deprived parts of London, and I think have to tackle that, because we need to make it easier for people to make healthier choices. And all of the issues we've got around obesity, kids come out of shop at school and they can get chicken and chips for £1, and they're at the corner of most secondary schools now, certainly my daughter's school. So I think that's got to be tackled, as well as alcohol licensing and the irresponsible sale of how alcohol's sold. Those would be my 3.
Thank you.
Open spaces, the value of open spaces, but them feeling safe, accessible and welcoming for community, both as an opportunity to mix with the wider community, but also around fitness and feeling better engaged.
And that, of course, will continue to be a big issue for the city as we try and squeeze 2 million more people.
Yeah.
And community transport as well. So public transport, yes, but also for older isolated people, unless they can get to places, they're going to continue to remain isolated.
Thank you. It's been, despite the disparate voices that we've heard from, I think a remarkably consistent set of messages, and I think a really kind of strong vision for London, actually, and the kind of communities and society we want from one that involves and helps younger people through to interacting with our elderly population. So thank you very, very much on behalf of the Commission. It's been absolutely fascinating. Ellen, thank you very much for hosting us. Thank you everybody for your time. We're going to reconvene in 5 minutes time and hear from a slightly different group, mainly with a kind of statutory bent towards NHS and local authorities. Our challenge to you, people who are about to come up and give evidence, is we'd like you to think about what you've heard this morning from this group of people that will perhaps change the topic we're going to discuss next, which is about the integration mainly but not exclusively of statutory services. So thank you very much.
Thank you.